Medicare is seeking input and feedback on several different issues. Can you tell us about those?
Medicare's including requests for information in the proposed rule is a habit that's longstanding, and it's a great opportunity. It's before they set any policies in. Well, it's never in concrete with Medicare. It's always changeable with the next rule cycle. Um, but they're specifically looking for input about MVP adoption and subgroup participation. They're looking ahead to the sunset of traditional MIPS and the advent of a full-time MVPs, and they want to know how you feel it can be implemented. And they give a number of specific questions in this request. I think the best place to find it is in the fact sheet that comes out with the proposed rule. And you can find this on the QPP website. Look at the resource library. There's a regulatory section, a box section near the top of the page, and you can access the fact sheet. And this will outline all these RFIs. So one about the MVP adoption and subgroup participation, one about the public health and clinical data exchange objectives in promoting interoperability. I think they're a little frustrated with how little progress is being made on that, and they want to know your thoughts about how to make this more achievable. And also, they want to put more patient-reported outcome measures in the measure inventory. And they want to know your feeling about that and suggestions for how to make that work. They're also thinking about the CAPS survey, the Consumer Assessment of Healthcare Providers and Systems for MIPS. And they've done a recent study that shows adding a step to the survey increases participation. Specifically, currently, the survey starts with a mailed survey request. For those patients who don't respond to the mailed survey, it's followed up with a telephoned request. They're proposing to add a new first step before the mailed request goes out to offer a web access to the survey. And their preliminary studies suggest there's a 13% increase in response rates in the current protocol. They're concerned that it could increase the cost of the survey and want your opinion about the feasibility of adding that web distribution. I think also anticipating that it may be difficult to get the email addresses necessary to distribute it and how you feel that might work. I think those are the major things. There may be some others, but these are the ones that you call out in the fact sheet.